This was a real-world evidence study for the use of carfilzomib among multiple myeloma patients with at least one prior line of therapy across 10 European countries and Israel. In this study, we included 701 patients, and 55% of these patients received KRD, while 39% received KD. There were another 6% of the patients who received other combinations, but these were not included in this analysis for obvious reasons because of the very low number of patients. Firstly, we've seen that KRD patients were younger. Half of the KRD patients had an ISS1 disease. More KD patients had ISS3 disease. As expected, KRD patients were more fit, while half of the KD patients were frail. And also, we included several patients with cardiac comorbidities, as this happens in the real world, especially 49 and 60% of the patients KRD and KD arm had some cardiovascular problems, and especially arrhythmias. The median time of prior lines of therapy was 1 for the KRD patients, while the KD patients were more heavily pretreated with a median of 3 prior lines. The high overall response rate that was described in the respective phase 3 studies was also described here. We had around 86% for the KRD and 68% for the KD, but as I mentioned, the KD was given in patients with the prior lines of treatment 3. So I think that this is considered very good. Also for the KRD patients, we had 66% of VGPR or better. Deeper responses were seen in early lines of therapy for both KRD and KD patients. And on average, carfilzomib was administered per the EU label in KRD cohort, and with some dose adjustments in KD cohort, which received the EU label of 83%, more or less. 90% was for the KRD. The duration of treatment was around between 14 and 15 months for KRD and 7.5 months for KD, which is I think very good and much better than other real-world studies. The carfilzomib safety profile was totally consistent with the prior treatments, and we can say that this real-world setting, carfilzomib used in accordance with the EU label, inducing high response rate and maintaining treatment for long duration with very good safety.